Welcome to Golden Pediatric Dentistry and Orthodontics. Hi, I'm Dr. Jones, an employee of Dr. Golden as one of his pediatric dentists. This practice places a strong emphasis on the prevention of dental disease. This short video presentation is to outline from you some of the aspects of our prevention program. We begin the process by having your child watch us in the mirror where we're able to show them where they're missing during the brushing process. This is followed by us flossing their teeth to both remove any interproximal plaque and to determine where and how much bleeding occurs during the process. It is from these two steps that we come up with our grades that you will find on the report card that we will be presenting to you today. The first grade being the oral hygiene grade or brushing grade, and the second grade being the gum health grade or the flossing grade. It is the gum health grade that has become the most important one to me over the years. This is because each day when we are treating teeth, almost 90% of the cavities that we find are in between the teeth. As a result of that, for this reason, I have become a big fan of flosses that have fluoride on the floss. The fluoride in the water and the fluoride in the toothpaste gets everywhere except in between the teeth. By using a floss with fluoride, you're now able to get it where it's needed the most in the contact area in between the teeth. Since most of the cavities that I'm finding each day are in between the teeth, I have shifted my strongest emphasis to that of flossing. Flossing, flossing, flossing. I am not de-emphasizing brushing, however, but I cannot emphasize enough the critical need to floss at least once a day and ideally twice, with the bedtime being the most critical time. Also, during your child checkup, we are assessing their ability or their dexterity to be able to floss and brush on their own. For those who are able to do it on their own, then we do demonstrate to them how to do it and have them demonstrate back to us that they have been able to achieve that capability. For those who are not capable to do it on their own, then we will be demonstrating to you as a parent later on the video to show you how to properly brush and brush and floss your child's teeth. Now, let's talk about toothpaste. There are far too many brands of toothpastes on the market for me to address them all. However, the important factor about toothpaste for me are these three factors. Number one, do not start your child on a fluoride toothpaste before 18 months old. Number two, from 18 months old, your criteria for choosing a toothpaste is one that has fluoride in it and that your child like it. Number three, although it does not matter to me what type of toothpaste you use or what brand of toothpaste you use, but it does indeed matter to me how much toothpaste your child uses. Years ago, surveys of both pediatric dentists and general dentists across the nation found a significant number of preteens were having their permanent teeth come in with varying degrees of white spots or other discoloration on their teeth. These areas were called fluorosis, and most often are a result of the child swallowing an excess amount of toothpaste. Many of them follow what they see on TV by using a large glob of toothpaste on their toothbrush, and which is far too much for them to be utilizing. It wasn't a problem with the amount of fluoride in the toothpaste or the water supply. Instead, it was clear that it was this excessive use by those who do not do a good job of spitting out the excess. The ideal amount of toothpaste for a child to use during the brushing process is what is described as a pea-sized amount. And the best way to achieve that is by going widthwise across the brush and just putting a little blob onto the brush. And by going widthwise, you're putting the ideal amount onto the brush. Utilizing this method, using a pea-sized amount or less, it is unlikely that your child would have a problem with fluorosis. Also, by smashing it into the brush, that's even less for it to come off for them to swallow, or for you as the parent to have to clean it out of your sink. Again, parents ask me over and over again, how much toothpaste, how do I avoid getting my child from swallowing too much toothpaste? The answer to that question is simple. By controlling by how much you put onto the brush. By putting the least amount that you put on the brush, that's less that they're going to swallow. And by using a pea-sized amount or smaller, even if they swallow the whole amount, they can't do any harm to causing the fluorosis to the teeth. The last prevention procedure that I wish to discuss is that of sealants. The first and best thing that happened in dentistry was when they put fluoride in the water, in the drinking water supply. A close second to that was the introduction of sealants. Just as I spoke earlier about the majority of the cavities are being found in between the teeth, the second most frequent area is location in the pits and grooves of molars. Although primarily used on the permanent molars, there are circumstances where they are appropriate on other back teeth, and those situations are discussed on a case-by-case basis. Therefore, sealants are an outstanding procedure, a prevention procedure. It's not a filling that fills in the pits and grooves of the teeth to avoid getting cavities. This concludes my portion of the video presentation of our oral hygiene visit. Later on in the video, you'll be seeing a procedure that show you how to properly floss your child's teeth. Thank you very much, and welcome to Golden Pediatric Dentistry.
Hi, my name is Chrissy. I am one of Dr. Golden's dental assistants who works with Dr. Jones. As Dr. Jones mentioned earlier in the video, I will be showing you both how I floss my young son's teeth and how I floss my own teeth. So if you have teenage children, you will know how to reinforce how they should be flossing. And with my son, I usually have him sitting down right in front of me, and I have his head tilted back. Take a short amount of floss. I'm right-handed, so I take the floss and I wrap it around on my left fingers, so I have this much floss to work with. I take a small section and I simply you can start anywhere. I start on his upper left side. The gums on the top are usually a V shape, so I want to make sure when I'm flossing I go in between on both sides of the V, and on the bottom I do the same on both sides of the V. Tilting his head back, and I just start in the upper area. And I'm moving the floss a little bit so that I have a new piece of floss that goes in between their teeth at each time. Doing the same with the bottom. Dr. Jones also wanted me to tell you about when my son was much younger. I had less cooperation than today. So I want to explain what worked for me in those earlier years. I'm not saying this is our recommendation to you, but when he was younger, I used to take him out. When he got out of the shower, I would simply wrap a towel around him so that his arms were by his side, and then I would have him sit down, and I would do the same technique and do the flossing. That way it would be a lot easier for me. Now at this time, I'm going to show you how I floss my own teeth so that if you have teenage children, you can reinforce the flossing to them. Again, I simply take the floss and wrap it around on my left fingers, and I have the small area of floss to use. And I simply start in one area and just simply start flossing again, doing the V shape for the top and V shape for the bottom, getting on both sides. This completes our oral hygiene video. If you're watching this video at our office, please have a seat in the waiting room until we complete your child's checkup. Please read the handouts Dr. Jones gave you, and he will be meeting with you shortly to discuss the outcome of today's visit.